listen to this. Seminiferous tubes. To test this, I will ask you, of course, to recognize cell types in a high-power view. However, follicles, especially a Graafian follicle, is bigger, and a corpus luteum is so big that you're lucky if you can get the whole thing in the field under low power. So those you'll see under lower power usually. So here we have now, oh, look at that.
What is that?
That is a Graafian follicle. Pretty close to being a Graafian follicle. Looks like it's a little bit close to the edge there, but I guess that's it. Not the most typical looking one I've seen. But you see how it has managed to slice through the egg. And you see how big it is. This is low power. So we're talking about, you know, a pretty big structure within the structure of the ovary. That's good. Then we have, here's a higher power view of it. This is medium power, and it fills the whole field. So that's why I say that the Graafian follicle is usually best viewed at like 100 power, 100x, the 10 and the 10 power objective. And all of these little cells, these are the follicular cells that make estrogen. They don't make progesterone, they only make estrogen. And just to point out a word that's also not in the book, but it should be, the lumen of a follicle is called the antrum. The antrum is the lumen of a follicle.
That has a question.
Might be.
Repeat.
One more time.
The lumen of an ovarian follicle is called the antrum.
The lumen of an ovarian.
Yes. It's called the antrum. So this, you see, this is an antrum. That's fluid-filled, but you still got literally millions of granulosa cells, well, follicular cells that make estrogen.
Ovarian
The lumen of an ovarian follicle is called an antrum. So this would be the egg here. You might say, oh, look, this looks very strange. It has no nucleus. Well, the knife just didn't happen to slice through the nucleus. So you don't see any genetic material. But at least it got the egg or the oocyte with its jelly coat around it. And so there's a... now, looking again at the follicular phase, ovary. Here we have a very nice view of medium power. Let's zoom out a little more, zoom in a little more, sorry. And see what we can see under high power. And first of all, you can see a lot of these, the primordial follicles. I'll tell you what, I think I'll keep this under medium power because on the practical I would ask you under medium power anyway, because that's where you can sort of see the variety of what's going on.
So what would you ask us here?
So here, this is a mature follicle or Graafian follicle. If you look off to the side, these are primordial follicles here.
Little baby dots?
Yeah, well, you can see them.
Are those the white dots? Is that what they are?
Well, they have to see. You know, if I.
Slides make it hard.
Yeah, okay, I will have to zoom up a little bit, otherwise you'll recognize what I'm talking about. Okay. These are primordial follicles. And what it is there are actually a lot of little cells around the primary oocyte, which doesn't look like it has a defined nucleus. It's got chromosomes in there, because remember, they're stuck in meiotic prophase. They're going to prophase of meiosis 1, and they're stuck there for sometimes 40 or 50 years from the time your mother is 3 months pregnant with you until the time you get to your last cycle before the menopause. Could easily be 50 years. That's how long these cells could be stuck in meiotic prophase.
So it's pretty much like the seed shaped ones?
C-shaped, these? Well,
Like the ones you just said.
these. Yeah. They're not C-shaped. What you're seeing is the staining of chromosomes there.
Okay.
Ooh, that's kind of an odd structure. But look at this. This is a follicle that's just starting to get an antrum here. See? This is about as far as they can go in about 3 or 4 months. From a primordial follicle, in about 3 or 4 months they can get to this stage. And then in the last month before it might get ovulated, that's when they undergo that rapid expansion to become a Graafian follicle, if they make it. If they don't make it, which, as I say, 99.9% of them don't make it, they will end up going through atresia. Back to our Graafian follicle here. I saw this one. See this one here? That looks kind of like all shriveled up mass. And that is all it is. Oops. There was another one there.
There we go.
See that? It looks like just kind of a shriveled up blob. That's an atretic follicle. So if anything, if you see a follicle in the ovary or some mass that just looks like it's all shriveled up, that's what it is. It's a shriveled up old follicle, and they can happen at any stage during their development. They undergo so-called atresia.
You need to know that for the practical.
Yeah, you should be able to recognize an atretic follicle. It's an easy one, because they look like what they are, all shriveled up. Sometimes when I'm setting up the practical, if I see one that looks like a really strikingly good example of it, I might just ask what the name of the structure is. So that's an atretic follicle. Not in the book, but it should be. All right. This is what's called a primary follicle. It's bigger than a primordial follicle. It's started to undergo some development, but it doesn't have an antrum yet. See that the egg or the oocyte in there is the big cell. And you may notice that the ovarian follicle is also protected from the blood supply. No blood vessels can get in there. They can get in the corpus luteum once it explodes and it ejects the oocyte, in other words, ovulation. But until that time, that developing egg, which is genetically different than mom, is protected from mom's immune system by all of these follicular cells. Even at ovulation, it is still surrounded by a layer of follicular cells, which will prevent it from being seen by mom's immune system until it gets safely protected to where it can be on its way to fertilization and implantation. Okay, so that's the follicular phase.